Ladies and gentlemen, my speech today will be about medical marijuana. And after listening to my speech, you, my onlookers, will understand the benefits, the two main components, and the risks of taking medical marijuana. So imagine you being diagnosed with an illness that will lead you down a path to misery and chronic pain. Wouldn't you want an alternative form of medication that won't lead you to an opioid addiction or an overdose? Well, medical marijuana is an option for you. And although it's not strong enough to help you with severe pain such as post-surgical pain or broken bones, it helps millions of Americans battle chronic pain each year. And medical marijuana is a great alternative medication for some people. Using medical marijuana for your illness can help you avoid the risk of an overdose or the addiction. Some people actually use medical marijuana to help them battle their addictions to opioids. And some people can use medical or pain medications such as like Aleve, Advil, ibuprofen because of kidney problems. So their only option then would be to use medical marijuana. Today I will help you understand the basic benefits, the two main components, and the risk of using medical marijuana. So ladies and gentlemen, let's move on to my first point, which is the benefits of medical marijuana. Medical marijuana is seen to alleviate pain in many illnesses, but chronic nerve pain in general. It is used to treat AIDS, anorexia, cancer, Parkinson's disease, and so much more. Partaking in medical marijuana also increases your appetite. That's why some doctors use it as a form of treatment to help with chemotherapy or AIDS. Medical marijuana is used to treat symptoms but not cure them. So it's not used to cure diseases. It's used to treat the symptoms. Using medical marijuana won't change the outcome of a certain disease, but it can help you ease symptoms, helps you feel good about yourself, and helps you give you a better quality of life if you have chronic pain. And then, now that we covered my first point, let's move on to my second point, which is the two main components in marijuana. Medical marijuana has over 100 active components inside, but there's only two that is used mainly for medicinal purposes. The first one is CBD. CBD is used to treat insomnia, anxiety, pain, and it's also used to treat a form of a life-threatening illness called epilepsy. Okay, there's a form of epilepsy, childhood form of epilepsy, which is seizures, called the Dravet syndrome, and almost nothing can cure this or help you. Nothing, almost nothing. But scientists have found that a CBD strain called Charlotte's Web actually helps a lot. CBD is the least controversial because it doesn't have any high that comes with it or intoxicating properties. The other main component is THC. THC is the one that causes the high when you're smoking or partaking marijuana. Physically, THC acts as a anti-inflammatory, and cognitively it's used as a stimulant. And now that we covered my second point, let's move on to my third point, which is the risks of using medical marijuana. And according to the National Cancer Institute, which states that there are risks of using medical marijuana, some side effects include increased heart rate, low blood pressure, short-term reduced memory, and a reduced attention span. Some cognitive side of it Side effects include impaired memory, sensory perception, attention span, among other things. Some long-term use has been linked to an increased risk of psychosis or schizophrenia in some users. So in conclusion, there is benefits, two main types and risks of using medical marijuana. So ladies and gentlemen, as we go about life and life moves forward and we go our separate ways, remember that you have an option to help you battle your illnesses other than opioids. Oh, and then if you guys look at that, that's a part, just play it.
Isn't it amazing?
He used just a single drop, and his hands afterwards were rock steady, and the dyskinesia left.
It was just flew back. It works most of the time. In fact, it's. Did you guys eat lunch? Oh, yeah.
So he drink that marijuana?
Yeah, CBD, and then it helped him. Okay, well that's about it for my speech today. Thanks guys for coming.